Content Manager OnDemand provides fast access to information stored in the system, dramatically improving account management productivity and customer self-service. In this video, a monthly statement has been received and reviewed by the customer. An issue has been identified and customer service has been contacted. The customer service representative, working directly with the client, resolves and documents the issue, and then analyzes the policy history in order to identify payment consolidation and coverage that would benefit the customer. We begin with the customer, Carolyn Thomas, who has both medical coverage and also supplemental coverage for dental and vision. She is enrolled in paperless billing and has just received a cancellation notice for her medical coverage due to a missed payment. Carolyn opens the email and sees that links have been provided for both of her policies. She clicks on the link to review her medical coverage. After verifying her credentials, Carolyn is automatically redirected to a page showing an overview of her monthly statement and policy. She notices that her premium is larger than normal. She clicks on View Statement to look at the details. Carolyn is able to see a breakdown of the coverage and associated premiums. She sees that her statement shows no payment for the current month and a late fee applied to the premium for that missed payment. She knows this is a mistake because she had sent a check for this premium. Carolyn clicks on Chat to open up an IM session with a customer support representative in order to correct this error. As a customer service representative, Dave Adams is responsible for resolving customer issues in order to both improve client satisfaction and to also influence company business results. Dave has gotten all the details he needs from Carolyn. After asking her to stay online, he opens up account management and searches for Carolyn Thomas using her policy number. The search quickly yields a list of statements for Carolyn's policy. Dave quickly sees the increased total due for the most recent statement. Dave opens Carolyn's statement to verify the details and confirms that payment was not received and that her coverage will be canceled if the payment and late fee is not paid. To see where the problem could have occurred, Dave begins by doing a search for all transactions reports. These are computer-generated output of all transactions logged by the system. He opens the most recent customer transactions report and selects Find All to see all transactions related to Carolyn Thomas. The search returns a list of all transactions related to Carolyn's policies. From the transactions history, Dave notices that multiple payments were made on the most recent supplemental policy and that one of the payment amounts matches her medical insurance premium. This payment should have been applied to her medical coverage. He also notes that there have been several instances of additional fees being applied to both accounts in the past. Dave wants to confirm the scanned check in question, so he opens up a search tab and looks for checks with Carolyn's bank account number. He opens the applicable image and sees that Carolyn's payment was received, but as the policy number was not listed on the check, it has been mistakenly applied to the supplemental policy. Having identified the issue, Dave begins the resolution process by creating an annotation on her current medical statement. Dave opens the chat window and explains the error to Carolyn. He communicates that he'll correct the error, remove the late fee, and that her medical policy will not be canceled. He comments that her payments have had additional fees added in the past and offers some additional analysis. Carolyn accepts this offer. He starts by finding all of Carolyn's monthly policy statements, selecting them, and choosing Mine with RMS to begin his content analysis. Dave begins his analysis by grouping Carolyn's statements by applied fees and then by policy type. He quickly confirms that a number of fees have been charged to Carolyn's premiums. Dave clicks on the Chart button to get a graphical display of the data. From the generated graph, he can clearly see a pattern of missed payments resulting in additional fees being applied to Carolyn's premiums. By switching to a consolidated policy, Carolyn will save a few dollars while also simplifying her monthly payment plan. Dave returns to the chat window, shows the payments graphic to Carolyn, and recommends consolidating her plans into a new coordinated care plan. She accepts the offer as it will provide savings while also simplifying her payment plan. Carolyn thanks him for his help and ends the chat session. Dave needs to process both the corrections for Carolyn's prior payments and also the consolidation of her policies with the new coordinated care plan. To start the process, he needs to send an email to the accounts department. First, he selects Carolyn's current medical statement and clicks on Send as Link. This opens up a new email window. In the email, he outlines the steps needed to resolve Carolyn's payment error and provides instructions for transitioning to the new coordinated care plan. All relevant documents are provided as links in the email. This keeps the content within the repository, reduces the overhead of sending attachments, and restricts access to only those with the correct permissions. In this video, IBM Content Manager OnDemand has provided account management for the healthcare industry. Customers have access to their statements online 24 hours a day, 7 days a week, while businesses can quickly capture, access, manage, and mine their content across all systems to provide efficient and superior customer service. For more information, please contact IBM. Thank you.